Welcome to Medico Foot Care. In this video, we can see demonstration of Medidop ABI Vascular Doppler Recorder. It is used to identify the peripheral arterial disease (PAD) for diabetic patients. In this machine, we can supply with 8 MHz transducer vascular probe, foot recorder switch for capture PVR waveforms, extension spring cable, ultrasound gel, RS-232 USB serial port cable for connecting PC interfacing software system, BP standard dial meter with cuff set. Peripheral arterial disease is a common condition in which narrowed arteries blood flow to your arms or legs. Do not receive enough blood flow to keep up with demand. Doppler technology uses sound waves to detect blood flow and identify any differences in blood pressure within different areas of the arms and legs. The transducer sends out high-frequency sound waves and then listens to the response to create an image based on the sound reflected back at the machine. The best Doppler signal will be obtained with the probe at an angle between 45 to 60 degrees to the artery. The artery may not be parallel to the skin, and adjustment of the probe may be required to obtain a good signal. Risk factors of PAD: 1. Smoking. 2. Alcohol. 3. Increasing age of atherosclerosis. 4. Prolonged diabetes. 5. High blood cholesterol. 6. High blood pressure. 7. Heart disease. 8. Stroke. According to the WHO statistical report says, over 10 million people in India have PAD. Peripheral arterial disease, like way 1 in 20 Indians over age of 45 have PAD. Untreated PAD can increase person's risk for heart attack or stroke. Instruct the patient to be in supine position as flat as possible for 15 to 20 minutes and explain the procedures carefully. Ensure correct ultrasound gel is used to give effective transmission of the signal. Apply gel over the brachial pulse. Hold 8 MHz Doppler probe gently over the brachial pulse until a good signal is obtained. Once correct arterial sound is detected, and checks the PVR waveform on your monitor. The output of the Doppler sound is usually presented as an audible signal, so that a sound is heard whenever the correct waveform is screened, then captures PVR waveform by pressing foot recorder switch. Our Medidop software program will automatically capture 5 seconds waveform and store it. After capturing the Doppler waveform successfully, start procedure for blood pressure with the corresponding spots. Inflate the cuff until the signal disappears. Gradually lower the pressure until the signal returns. This is the brachial systolic pressure. Repeat the process at least one more time for ensure the blood pressure reading is correct systolic value. Place the sphygmomanometer cuff around the leg immediately above the ankle. Locate the pedal pulse using the Doppler probe. Avoid excessive pressure. Once correct posterior tibial arterial sound is detected and getting steady PVR waveform on your monitor, press foot switch to record the PVR Doppler waveform, capturing for 5 seconds and store it into your system. Inflate the cuff until the signal disappears. Deflate the cuff until the signal returns. This is ankle posterior tibial systolic pressure. Repeat the process at least one more time. Make a note of each readings. After successfully completed posterior tibial pedal pulse, then place 8 MHz transducer probe to dorsalis pedis arterial signal. Once correct dorsalis pedis arterial sound is detected and getting steady PVR waveform on your monitor, press foot switch again to record the PVR Doppler waveform. Inflate the cuff until the signal disappears. Deflate the cuff until the signal returns. This is ankle dorsalis pedis systolic pressure. The position of the cuff is important. The measurements reflect the pressure required to occlude the artery between the cuff, not where the Doppler is held. Repeat the same procedure to find out PVR waveform and systolic blood pressure to the left side brachial, posterior tibial, and dorsalis pedis. Verify all positions are tested and blood pressure reading are to be entered in the software carefully. Our Medidop ABI advanced software can calculate automatically ankle brachial index and interpretation results value. Check once again all data are entered in the fields. Then click Save the patient data into your system. Our Medidop ABI Vascular Doppler recorder is working on the Task 2 guidelines for ABI studies. We have a provision in our software system to easy customize the interpretation rules based upon your recent studies or research papers. According to this references, the final reports can be generated after you completed the screening with patients. Our Doppler can generate various types of A4 size report formats. Ankle Brachial Index Report, Carotid Brachial Index Report, Penile Brachial Index Report. This test is controlled by our own Medidop ABI software system, can store patient data, view reports, and take a 4-size color printout. We are offering high-quality unidirectional 8 MHz vascular probe, high-resolution real-time PVR waveform, good acquisition Doppler sound, easy custom set interpretation rules, multiple operation printout runs, save and take color or black-white printout reports, easy export to PDF report facility, email patient reports. We are also supplying other extensive vascular Doppler products. Provectus Mini Medico all-in-one diabetic lab packaging products and Visiodop 2-in-1 digital biotheziometer cum vascular Doppler products. For any queries, information, order, please contact our customer service. Thank you for watching our Medidop ABI videos.